Do you believe in my body, my choice or not? Because it can't be selective. And
I think
democracy has downsides.
I think that's a political slogan, and I don't believe in any political slogans.
Abortion should be legal then?
I think.
Or do you believe women should be banned from choosing what they want to do with their own body?
This is Here's How, Ireland's political, social and current affairs podcast, presented by William Campbell.
Thank you for downloading episode 131 for the 17th of February 2022. In a moment we'll have that interview with Ewan Mackenna. No rant this week because the interview is long and I probably rant enough in it anyway. But first I just want to say thank you to all of my donors on Patreon. I really appreciate them all. Patreon is a web service that allows you to donate €1 or €2 per podcast or per month, and that helps us to devote more time to research topics and to find interesting guests for the podcast. If you think that you could do the same as those donors, there's details on the website and at the end of the show.
Do you agree? Do you disagree? Follow at Here's How Podcast on Twitter and like Here's How on Facebook for updates on each show's contents.
I think I possibly have a congenital genetic defect in that I was born without the sports gene. And that might be why I didn't really come across Ewan Mackenna until some listeners got in touch with me and told me that I should talk with you, Ewan. So just in case anybody else is suffering from the same genetic defects as me, can you tell me and those people exactly who you are?
Yeah, sure. I was a sports journalist in Ireland for 13 years, former Sports Writer of the Year, runner-up 6 or 7 times, written 5 books on sport. Moved down to Brazil then for 7 or 8 years for the World Cup and the Olympics. Currently in Portugal, and I guess my relationship with former employers, former colleagues, all these people isn't what it once was, because they might say something very different, but I'd say I stepped out of the echo chamber that a lot of media companies were making a lot of money in COVID. All of a sudden, companies that have been struggling before through ads from government, etc., wash your hands, all these things. And they didn't like that I was unhappy with their consensus, with that echo chamber, with the fact they weren't asking what I believed to be basic, logical questions. And I always had for example, in sport, I was never into who's the best left back or if that's a good pass or who's going to score more goals. I always try to look at social issues through sport. And then when COVID comes along, I guess I was I think upset at what was happening that I let sport take a little bit of a back seat and tried to use the same journalistic skills, which was always to kind of comfort the afflicted and afflict the comfortable. To kind of look at COVID and what was being done and the certain kind of one group of experts that were allowed to promote one side and how basically protesters were shot down, freedom of speech was shot down. There was no talk, there was no risk reward analysis around lockdowns, there was no looking at the long term.
Okay, well let's talk about that. Let's talk about that in a moment. But I just want to, listeners to this podcast will know that I have a relatively rocky relationship with RTE, to say the least. As I said, I wasn't aware of you until entirely through my fault, not because of any lack of prominence on your part, until some listeners drew my attention to you, and thank you to them for that. But you were in RTE, and I think one of the reasons why I am thoroughly loathed in RTE is because I drew attention to the fact that it is, let's say, a hereditary employer. And I think your dad was in RTE as well. Am I right? Are you perhaps
He was. My dad
are you
was
a prodigal child?
For years in RTE in the 80s and 90s, left in kind of the later 90s, and even he's appalled by what RTE has become. Now, maybe I was too young to remember. Was it always like that? I think it's gotten a lot worse. I think it's got a lot more Dublin 4. I think there's I suppose the same guests doing the loops, promoting each other, promoting their self-interests and trying to promote a country that suits their needs and bends over to their needs. And they do that in many ways through fear, through keeping people down there, for example, fighting amongst each other.
Pause on that thought for a bit, because isn't that kind of the song of the minority? It's not fair me being that so many people disagree with me just because I'm in a minority. That's kind of naturally the case, isn't it? Is it not the case that just there will be minority viewpoints and you can't demand anything other than a minority share of the attention in that case? Isn't that true?
Well, I think a public service broadcaster should be broadcasting public service. They don't do that. They're a mouthpiece for elitism, from Ryan Tubridy through to Claire Byrne, through to all these people and throughout it. They have had a very specific view in COVID because COVID was their biggest concern. Their health was their biggest concern. It wasn't everybody else's. A lot of people needed to work. And they went after those people in such a way. And it's quite something.
Okay. Pause. We're getting onto COVID then. That's probably a good vehicle for what you're talking about. But I think it's important to be very, very precise. And again, people who are perhaps in a minority or have a less widespread viewpoint can perhaps see conspiracies all over the place. It's important to avoid that. So I like to be very, very precise in language, and I know that you aspire to that as well. And can you give me an exact example of what you're talking about?
Okay, I will, and I don't think it's a minority, by the way. I will give you an example. That take the Late Late Show, which I don't know if people like it or not, but it has huge reach and has huge influence. Micheál Martin goes on the Late Late Show, and he's given a warm welcome and a soft interview. Leo Varadkar goes on the Late Late Show, is given a warm welcome and a soft interview. Mary Lou McDonald, and who I've no time for Sinn Féin at all, but as the most popular party in the country at the last election, comes on, and Ryan Tubridy's first line to her was, well, I know you're not everybody's cup of tea, but we have you here for the sake of balance. And this sort of thing is always...
Pause on that. There are multiple readings of that, isn't there? Because sure, Sinn Féin at just under 1/4 of the vote was the most popular party in the country by a shade, but they were also, by a wide margin, the most unpopular party in the country. You know, an interviewer has to acknowledge that when he's opening an interview, doesn't he?
Well, it depends if he does it with everybody. For example, we've had Claire Byrne and RTE have apologised to Pascal Donoghue at one point for stating a fact about him and children's shoes. And there's a theme of soft sop interviews on one side, and we see that with RTE all the time. There was a theme.
By the way, Ewan, I completely agree with you. I'm trying to draw you out here, but I completely agree with that there is a narrowness in the focus in RTE. But I think that comes from an insularity, from a failure to get new talent, which is epitomised by the enormous number of family employees. That's to say, people who are employed who have various other members of their families employed as well. And I would take issue with the suggestion that this is a grand conspiracy. It's not because they're thinking too much about it. It's because they're not thinking about it at all. Would you agree?
Well, I would imagine upstairs, and I'm this is just my opinion because it has to be run like a business, that they saw in COVID they were returned to profit for the first time in a decade. Through ads, through more readership.
No. Their advertising collapsed to such a degree that they started getting just cash straight from the exchequer in order to bail them out. And there's no question that RTE has a very problematic funding structure because it's a hybrid that is neither fish nor fowl and doesn't serve any of those masters terribly well. But I want to move away from RTE, and particularly you've been critical of a whole bunch of things around lockdown in particular. And again, I think maybe you and I might share a lot more opinions than people might expect in terms of, I would have, a very strong belief in civil liberties and a belief that any what are called emergency measures have to be very carefully limited in scope, or they have a danger of turning into permanent infringements of civil liberties. And there is a high bar to justify them, but that bar does exist. And my point is that a lot of what I see of the criticism is, I think, an unthinking blend of civil liberties, defense of civil liberties, and attacking some of the science and the medicine, and blending this and saying that, well, I disagree with this particular public health measure, which I think is very valid. Therefore, I also believe that the science on which it is based is bad science or is wrong. And if some other scientist comes along and tells me that science is incorrect, however untrustworthy the science that suits my agenda is, I'm going to believe that regardless. There's a lot of that happening, isn't there?
Yeah, I think it's human nature. And on both sides, you will be drawn towards an article or a study that suits your particular viewpoint, not realizing that there's probably a counter study out there. And it was one of the things when people said follow the science, as if there is just one brand of science or one outlook. I mean, that's an outlook that's anti-science. We were learning as we went. But I think the problem for me was the lack of conversation, the lack of dialogue, the lack of wondering, well, hang on, okay, we're doing this in the short term. A, what benefit will we get out of it in terms of COVID and a very serious illness? And B, how does that match up against what we're going to do longer term in terms of other illness, mental health, inflation? We have now a wealth transfer. I believe Oxfam now believe 120 million children alone have been driven into abject poverty by restrictions because money wasn't circulating to poorer parts of the world. And that was the conversation that was needed early. And certain questions were obvious questions to me that were never asked. For example, we now know COVID was found rampant in Italian health services in September 2019. We know it was in Paris in October.
Roll back. We know. How do we know?
Studies. They've gone through, they've tested people from the Italian health service samples. In Paris, they basically went through the sewers and found it in feces.
Okay.
In London.
I want to pause that because I don't want to muddy up the scientific and the civil liberties, those two debates. But I absolutely agree that there is something there, and I want to come back to that in a moment. But I just want to make the general point and ask you if you would agree that if you have, for example, a particular government policy, such as how to build a motorway and where a slip road goes and how to design that and so forth, that's something that's been done thousands of times around the world and dozens of times in Ireland, and there's a fairly standard way to do that. And if the public servants who are involved with that mess it up, there's not really much excuse if they put traffic and lights in the wrong place, because this is something that's well established. When COVID hit, you kind of have to give them a lower bar, don't you? Because an awful lot of things just had never been tried before, and they were dealing with entirely novel situations. And it was absolutely inevitable that people would make mistakes. And the argument that you shouldn't do anything because it might make a mistake, in that case, is not valid. Would you agree?
Yes and no. To muddy it slightly. In terms of certain stuff, when you look back, and even at the time I would have said, and it wasn't just Ireland, by the way, a lot of countries, like the notion of moving sick elderly people with COVID from hospitals into nursing homes. Yeah. I cannot fathom that. And people can say I'm not an expert, but I mean, this is just logical stuff. The other side, yeah. I mean, and do you know what? When you saw some of the early data coming out, and obviously it turned out not to be true, but they were talking about kind of 8-9% mortality rate in Italy. That scared me. And it's sure, and absolutely. But
what was happening there? What was happening there was that they were missing a whole bunch of non-symptomatic or slightly symptomatic cases,
they were only
they were only finding
people.
Yeah, exactly, and they were getting 8-9% mortality of that. And you know, there were the images of, for example, leafing through an Italian newspaper with the death notices, and almost the entire paper was death notices, and it's very clear that there was an excess death far and away above what was normal. But it seems to me that those missteps, as unquestionably there were, those missteps are almost jumped on with glee in some quarters. And I'll give you one example of somebody who I had on this podcast, who's Padre Tobin of Aintu, who's one TD party, yes. But nevertheless, he's got a reasonable profile. And he said that the government had originally said that masks do not work and should not be used by the general population. And on this basis, defended another member of his party who was saying things that were utterly scientifically incorrect. But what Padre Tobin was saying was wrong, because it is true that the government had said that the public should not use masks, but that was in a context where there was an extreme shortage of those masks, and them being picked up by the public would have meant a shortage in hospital settings where they were much more urgently needed. And to try and bend the story in that way later on to suit a particular political agenda of saying that people should not wear masks, that's pretty dishonest, isn't it?
I think it's the tribal nature. This has gone on so long that people have become so invested and want to be right and want their side to be right.
But Patrick Tobin builds himself up as being a very logical, reasonable person who's morally driven. And whether he has persuaded himself to misremember or whether he has been informed by someone who is being mendacious, I don't know. But somebody who is an elected TD has a duty not to say things that are just objectively wrong. Isn't that true?
Yeah, I can't disagree with that, and all sides do it. I'm not here to defend Patrick Tobin or the other side or any part of the house, but I do think it's quite tragic that this is where we've reached in terms of honesty. I mean, and it's made debate and conversation so difficult because people become so entrenched and they convince themselves of one thing or the other, and both sides have done this, and I think that's been the frustrating part, in that, for example, I've stayed in the middle and I just wanted to talk about this and come up with the best outcome long term for people and look at the effects. Roll back.
Doesn't everybody say that?
Well, I mean, yeah, but I suppose I was looking at this and I was trying to, because it wasn't just a medical issue. It's a social issue, it's an economic issue, and I was trying to balance all these things up. And I was looking at people on full pay who were happy to sit at home, and they were calling people who actually were protesting in many, many cases legitimately and peacefully looking to work, and they were suddenly tarred as far right and all these other things. And
give me an example of that.
Well, for example, Pat Kenny and Claire Byrne would have called out, and the Irish Times, Conor Gallagher, would have called out fascist elements who were protesting. Matt Cooper had a man on his show talking about internment for anyone protesting during COVID on his Today FM show. And there was this rampant narrative throughout the media that, and it was quite a Trumpian thing to do, and that if you can discredit the messenger before they get their message out, no one listens to the message. And I'm sure there were fringe elements, as there is at any protest, be it the Canadian truckers, Black Lives Matter, whatever. There's always going to be a fringe element to tag on to these things.
Okay,
but I also know a lot of people who did protest because they were worried about their jobs.
You and I want to understand clearly what you're saying. Of the people who were actively, that's it, going on the streets protesting against masks and vaccines, including people, we haven't seen it in Ireland, but we've certainly seen it in the UK, people accosting and abusing children going to a health centre to get vaccinated. It's not proportionate to compare that to what are clear oversteps on the other side.
Well, I would never defend people. In fact, I'm here in Portugal, and actually there was a military man behind their vaccination campaign. And he was talking about both sides of this, and he was talking about the abuse of kids with their parents going in to get vaccines, but also the abuse of people legitimately out protesting, saying, I need to open my business, I need to earn a wage. And
pause. No, are you saying that people,
William,
go ahead.
They were genuine protesters, and there were many people there who were just genuinely worried that they couldn't have. I had friends there, and musicians, actors, I know.
Okay, yes, but of a tiny proportion. And just hold on for a second, because one of the things that you said in one of your blogs was that RTE is brainwashing people, and that people who've been brainwashed need deprogramming. Now, was that just extravagant language on your part, or is that something that you actually believe?
No, I think people, I was listening to a psychologist in America talking about how for every 6 months that something is kind of honed in on your brain daily, that this is bad or this is dangerous, that it takes double that time for them to return to normal.
Okay, but hold on for a second. You're seriously saying, and there is I don't know if it is medically recognized, but it's certainly a psychological effect of brainwashing. You're seriously saying that people simply watching RTE, and we will have seen signs like this, like RTE is the virus. And, people put extravagant things and so forth on signs and shout them in slogans. But are you saying that that's literally true?
Not just RTE. I think the media
but confine it to RTE for the moment. You're saying that it's literally true that RTE brainwashes people.
I think during COVID they did it. I think they've damaged people and ramped up the fear to a level that I'll give you an example. My own mum used to love going out for a meal every weekend. She was terrified to leave the house for a year. because you had the radio on, and she was listening to these things constantly.
People in that generation were in serious danger. If you're not willing to pull that back, that's fair enough. I don't want to stay too long on that. But I just want to put a point to you, and you'll be aware of, and I think most listeners will be, of what are called creationists, who are, we have some of them mostly north of the border in our own country, but they're mostly concentrated in the US. And they will say, for example, that they want their magical version of the world given equal time and equal prominence with science. That's just not a valid argument. And this is actually one of the faults in RTE, I would say. Yeah, you should have balance, but you can't balance truth with lies.
No, but you can balance.
And in this case,
scientists who like your message, and RTE, I can give you an example. There was a man on primetime early in this, and he had one view on science, and he worked for the HSE, and he ended up being sacked. He was never back on RTE again. I remember one morning listening to Sam McConkey. He was on Claire Byrne.
But I want to pause you on that. I don't want to go to the exact example. I want to go to the concept that if somebody says that Ireland should go on the gold standard, that's one economic view, and they could potentially have a debate with somebody who says that Ireland should stay with the euro or should choose some other financial system. Or if somebody believes in one particular religion, they can potentially have a debate with somebody who believes in another religion. But those concepts don't deal with absolute externally verifiable truth. If you're putting somebody from NASA on the radio, it is not balanced to bring on somebody from the Flat Earth Society.
No, but that assumes that all of science believed there was one way to follow this, and I can actually understand why people think that's the way.
There are people, believe it or not, with PhDs who profess to believe that the Earth is flat, but it is absolutely not valid to create a mirrored debate whereby you have on one side you have NASA who says that space and science is as it is, and on the other side you have somebody from the Flat Earth Society who says that the moon is made of green cheese. That's not...
How do we know in hindsight that those we promoted who said lockdowns work, and given that this week John Hopkins, who I want to talk gold standards, have released a report showing that actually lockdowns made minimal difference to death but caused huge damage in other areas?
We're going to go to that in a moment. How do we know the scientists
that were promoting this weren't the flat earthers?
Okay, because, and I'm not a scientist and neither are you, but I am aware of the systems that they use, which are principally peer-reviewed research. And we know that science works, and we know that the way that we work science works. That doesn't mean that everything that every scientist says is correct, and it doesn't mean that every scientific conclusion that we come along with is correct. But we know that running science, the way we run it, has given us unbelievable advances in the past couple of centuries that are just not comparable with faith-based systems or anecdotal-based systems that we had used previously.
But the problem, William, was scientists in this tasked with this were looking at one specific area, COVID, how to keep COVID under control. And
that's
that wasn't
valid,
just
and
the
that's
only issue,
absolutely valid. Yeah, and I think that's absolutely something valid to comment on, that if your only variable is reduce COVID to the maximum possible degree, well, how could you eliminate COVID? You could nuclear bomb the entire world. Then there'd be no COVID. So I think what you're saying on that is completely valid. That's to say, it is a value judgment that perhaps politicians and civil society commenting on it, that politicians should make, saying that here are the options that the scientists have given us. We now, as the moral and the philosophical and the political leaders, must choose between those options as they are scientifically informed.
Absolutely. And I think the politicians in a lot of cases shirked that and said, well, Neffet, for example,
totally
said
agree.
This, rather than take that advice and balance it with economics, with social, with all these other things, and then make the judgment. But the problem, I guess, then is they'd be held accountable for what happens. Whereas in this case, they can blame Neffet and say, look, they told us to do this.
Totally. I completely agree with you on that. And I absolutely agree that in many cases, you have politicians hiding behind sometimes legal advice where, legal advice told me I had to do this. No, legal advice, like scientific advice, is the answer to a question. That doesn't take into account what the actual question was, and it is for politicians to determine what the question is. The scientists can answer the scientific element of that. But you mentioned a Johns Hopkins study, which you said that lockdowns have almost negligible effect on death rates. And I think that's a very good example of what I'm talking about, because the study that you're referring to is in fact not a Johns Hopkins study. So one of the three authors of the study, it would appear, is employed at Johns Hopkins Hospital. The other two are not. But this is not in any way given the imprimatur of the employer of one of its authors. But all three of the authors are associated with what's called the Cato Institute, which is a deeply political organization. The study has not been peer-reviewed, and it is not a study ab initio. It is what's called a meta-analysis. Sometimes meta-analysis are very, very important. What they essentially do is they take lots of other studies and aggregate the data from others so they can get a broader view. But a large portion of the studies that they are aggregating are themselves not peer-reviewed. They're what's called working papers. So it's essentially one scientist emailing another. It doesn't have any academic standing. And in the way that this study has been put together, it is very clear that there are highly political choices being made in order to include studies that, in the way that they're counting them, they're including studies that the way that they count them reduce the apparent effectiveness of lockdowns, and excluding studies which would contradict their thesis. And in particular, several of the people who wrote the studies that they are aggregating are flatly contradicting the conclusions. So the authors of the original studies are saying that what you're taking from my study is incorrect. And they are also applying a mathematical model which has no apparent justification, which is taking from studies which apparently show a strong effect of lockdowns and saying that we've run through some fancy maths on this, which is not terribly transparent, and we think that even though it says one thing, it says what we want it to say. You tweeted several times, the media are not highlighting this Johns Hopkins study. A, it's not a Johns Hopkins study, and B, it's garbage. Any editor would be completely justified in paying no attention to it whatsoever.
Well, the media have set their own standards in this, and it's quite interesting that stuff is garbage that we don't like, and I believe
it's not garbage because what we don't like. It's garbage because it has no academic standing.
But academic standing isn't the real world. This is the problem. These are numbers, and this is why academia believes lockdowns will work, because they believe everyone will behave in a way they think it does on a blackboard with no real world life.
But hold on a second.
At 8 o'clock. And no one will go out afterwards.
Sure. But that's a political, that's a political decision, and I completely agree with you that that's open to question.
But we didn't vote for academics to rule our lives, William. This is the key point in this.
No, Ewan, let's stick with the thing. The claim is that this study shows that the lockdowns were not effective.
Correct.
This study is academically a dead letter. It does not adhere to any good scientific.
But what happens if it is peer-reviewed and
nothing
given the green
at all?
light?
Okay. Well, A, nothing at all, because it is based on studies that themselves are not peer-reviewed. And B, it is drawing conclusions from those studies that the authors of the original studies say are utterly wrong. And C, there is a slew of other studies that are of far higher quality. I'm going to put an asterisk beside that higher quality, and I'm going to come back to it. But it is going against the findings of a whole slew of other studies that are of far higher quality that say the opposite. So what I want to draw out of you is the point that you've jumped on this, you've tweeted widely on this, you've been talking about this quite widely, which you're entirely entitled to do. But can you not acknowledge that this is an outlier study that comes from highly politically charged researchers who have no expertise in the area that they're researching, and who are interpreting studies by experts and saying that the studies say is something different than what the experts who wrote them say they said? That is not quality science. And I said that I would come back to defining that. Scientists not only are able to measure a whole lot of things, from the distances to stars to the size of viruses, scientists also have very, very clearly defined measures of the quality of scientific work. And that depends on how many citations that other scientists are willing to make of that study. It depends on the quality of the authorship and a whole slew of other things which are fairly openly available. And promoting one study that has a whole lot of problems with it, that says one thing that suits you, and ignoring a whole slew of other studies that say the reverse and are clearly of a higher quality, that's politically driven, isn't it?
Well, three things I'll say on that as I'm making notes here. Listen to you. I'm looking. I just brought up on my computer
I'll let you talk for a minute.
I'm looking at 64 studies from the Robert Koch Institute to the Lancet, showing endless. I've had this throughout a list of whether lockdowns worked or not. Secondly, the scientific parameters as we go back to is, did lockdowns save coronavirus victims? I've always looked at this through a far higher macro level than the micro of COVID, and I'm looking at 100 million kids driven into poverty, the greatest wealth transfer in human history, all these other things.
Yeah, you see, that's why I part from you there.
I can see what's happening.
Yeah, that's why I part from you, Ewan. So if you come along and say, look, here is the broad scientific consensus of how much benefit we got out of lockdown, and here's a broad scientific consensus, or even just a reasonable measurement of how much it cost in all sorts of other things. Let's make a comparison of the two. Then I think that's a really valid thing to do. But if you try to use in that comparison the most extreme outlier and the most dodgy study from non-experts quoting people who explicitly say you're misquoting me, that tends to undermine the argument. And what I fear, the reason why I'm interested in this, is because I fear that the entire balance argument, which might call what you're talking about, and also the whole civil liberties argument, then gets polluted with this sort of anti-scientific label because people are quoting bad science in favour of it.
Well, if we want to talk clarity of science and good science, where did the notion of lockdowns come from to begin with? Because there were no pre-pandemic plan drawn up in the Western world before this. It was a Chinese idea. And frankly, if we want to talk clarity of information and trustworthiness, I'm not sure I'd be taking my information from the Chinese.
No, true. But the research as we have it does indicate that the lockdowns save lives. And many lives. Yeah, from COVID. That's absolutely correct. And that's the bit that I think is the very important debate that is getting lost, which is that we need to balance that against, for example, people couldn't get cancer scans when they could have. And there is a measurable number, and you may not be able to say this person's cancer would not have happened and that person's would have, but you can say there is a specific increase in the number of people who are dying because their cancer wasn't caught because they couldn't get a scan. And that's absolutely a debate to have.
But you, and I'm curious your thought on this.
Sure, go ahead.
Do you think then when, for example, if we can't obviously put a clear figure on that, but we're putting clear figures on COVID deaths, and I don't mean to reduce misery and grieving to numbers, but ultimately I guess we have to look at this coldly and empirically. All those people who died of COVID, we say, however many millions, would not still be here. And we need to look at it that way as well in these scientific studies. And I don't think that was done, because I think an excess amount of COVID deaths were lumped on to people who were dying anyway. I had a friend who died of cancer but got COVID in hospital.
Yeah, but there's
it was a mixed death, his case.
Yes, and that can happen. But there's a whole lot of nonsense talked about that as well. And there's some sort of hand-waving about comorbidities. But for example, we had John McGurk of Gript, who is a young and relatively healthy fellow, and he's younger certainly than me, and I think possibly also younger than you. He has a comorbidity. If he died of COVID, would he be in this group who have a hand waved at them and say, sure, they were sick anyway, because he has diabetes, that's why.
Well, and I do understand that.
Yeah. And there's
it was a kind of a tiptoeing exercise, because to be honest, I feel awful for anyone who
I completely
their families, anything in this, and I do recognise that.
Yes, and for example, people with asthma of any age were at very significant risk. And to try and characterise all of them as Granny, who was nearly 90, who would have pottered along within a year or two anyway, they're grossly overstating that. And I have a problem with that. Ireland, if you look at the total excess deaths, we got away very, very lightly, but our total COVID numbers. But in countries where they did not, out of choice, or they didn't because of essentially lack of the mechanisms of civil society, be able to do that, there are astronomical levels of excess death. And if we had done nothing and just chosen not to take any of the steps that, for example, countries like Peru were unable to take, it seems clear that we would have had that as well. Isn't that true?
Well, no. I suppose when having lived in Brazil for years, and we talk about the politicization of this, and I've spent my life writing against Bolsonaro. I had to leave the place for a while because it was getting quite shady. But even at that, because it became political, for example, with him, when people said, oh, look, Brazil stayed open, everyone died. And it was two things. Brazil is a federal system and a lot of states locked down. But if you actually go to Brazil and you see the favelas, lockdowns aren't going to work when you have hundreds of thousands of people living on top of each other.
Yeah, Peru is
in terms
the
of the Western
example.
World in Ireland.
That's what I mean. They didn't really have the option to do what we did.
Will bother. If I say Sweden, William, and people will go, oh, and I'd be the first to admit Sweden made terrible mistakes around their nursing homes early, etc. But for the 18 months after that, Sweden did very little. And there wasn't this disaster. And there's one question I wished someone had asked this to someone in power. And I mentioned that COVID was with us September. We know, and I can send you on the links to all these sources.
But AIDS was with us in the 1920s, but not to anything like the degree.
Well, if it was in Europe, if it was in Rome, Paris and London in early September of 2019, and for 6 months we didn't put in one restriction, then that means one of two things. Either it naturally peaked at Christmas and went back down by the time we found it was here, or it wasn't that rampant. Now, I believe it was rampant.
No, it doesn't. No, it means that neither you nor I are an epidemiologist. That's what that means.
But you don't need to be an epidemiologist to apply logic.
Actually, you do, because these are incredibly complex issues.
Well, if you have to lock down to stop something spreading wildly, how can you not lock down for 6 months and it doesn't spread wildly, if that's the counter-argument?
No, that isn't the counter-argument. And I'm not going to debate that with you, because not only are you not an epidemiologist, neither am I.
But you don't need to. But honestly, you don't
honestly
need to be.
You do.
I'm not an economist, but I can tell you that inflation is rampant.
I don't know that it's rampant, but that is not my point. My point is that this is massively more complex, and this is just wide open to the Dunning-Kruger effect, which is essentially people who know so little about epidemiology that they don't know how little they know, and therefore assume that they know a lot. Let me put my thought on it this way, that the threshold for making a vaccine compulsory is very, very high, but that doesn't mean it's non-existent.
No, but I guess my problem is that most of the Western world, now not the United States maybe, but we've passed that threshold and we're still picking on people and we're still trying to remove their rights, even though we've reached a stage where
remove
they're
rights?
taking a risk to themselves at this point.
Give me an example of remove their rights.
Well, for example, in Austria, just south of you right now, you're going to be fined every month. In Greece, if you're over 60, you get fined every month for not being vaccinated. I can't go to see my local football team, even though I'm...
So what you mentioned in Greece and Austria, and I'm not sure that it's been implemented in both those countries, but one issue, and I want to draw to a close on this because we've gone way too long, but the one issue that I really take exception with is saying that somebody has a right to do X. That's fine. But then saying that if the whole of society doesn't accommodate that person and shield that person from all the consequences of their behaviour, then that is in some way an infringement of their rights. You have a right to not eat your dinner as an adult. You don't then have a right to not starve because you're not eating your dinner. You can't say that the whole of the rest of society has to organise itself around shielding you from your consequences. You have a right to both take autonomous actions and suffer or enjoy the consequences of them. And it is...
Well, surely the consequences then is them getting ill. If you believe in the vaccine and you've had the vaccine, then it's their problem the same way as...
Indeed.
If you're vaccinated...
Or it is the consequences that they will be excluded from various things. If you...
Why would you want to exclude people though? Say, for example, and I see this, William, that
let me clarify that.
Non-vaccinated person.
Let me clarify that. On the basis, if there is a good scientific explanation or with good scientific reasoning, you can say they then pose a risk to another person. It's entirely valid to say that you've made that choice, but you must suffer the consequences of being excluded from where you pose a risk to someone.
Doesn't that bring us back to
no? Let me qualify that. Let me qualify.
No. Let me purged people based on the need to keep them safe.
No, let me qualify that. However, I do not think it's valid to say we will impose this restriction as a punishment. Now, that might be a secondary effect. But where you can say, you have made a decision not to learn how to drive, therefore you're not getting a driving license and you're not allowed to drive on public roads. But if you make a decision not to learn how to drive, it is not valid to impose other irrelevant restrictions on you. But for sure, it is valid to impose restrictions on you based on your own choices, where you would then pose a risk to others.
I guess, you see, I would see this as slightly different, that if you have the vaccine and believe in the vaccine, then belief has no effort.
Belief has no relevance here.
Well, does the vaccine keep you safe or not?
That's not a scientific question. The question is, does the vaccine reduce transmission, severity of infection and death? And the answer in all three cases is yes.
So that's fine. So if you take it, you should be pretty fine. I mean, you're feeling good about yourself.
No. That's not. Unfortunately, that's not the way diseases work. Because just because I've passed my driving test doesn't mean that the gobdog driving on the wrong side of the road at twice the speed limit can say, "Oh well, you took your test, so you should be fine."
I wouldn't bring it to that. Because that's fine. But I mean, we're getting to a stage
the libertarian worldview.
No,
which I have a lot of
sympathy.
You allow me to finish. Allow me to finish. You allow me to finish.
Do you believe in my body, my choice, or not? Because it can't be selective.
I think
democracy has downsides.
I think that's a political slogan, and I don't believe in any political slogans.
Abortion should be legal then?
I think.
Or do you believe women should be banned from choosing what they want to do with their own body? Because once you start mixing, if academic people and government
the issue of abortion
over your body,
allow me. You've asked a question. You have asked a question, and since you've asked it, I will ask it. I think that political slogans are a poor guide to resolving philosophical questions, and the abortion issue turns on whether you believe a fetus from the moment of conception, or it's not a fetus, excuse me, a zygote from the moment of conception, is a human being with the same rights as all other human beings. And to me, that's a clearly incorrect view, although there are some people with religious views which lead them to the opposite conclusion. But I think from a scientific point of view, that's not possible to state. Therefore, I can't see a justification for making abortion illegal in those circumstances. But I don't believe in a slogan, and that's why anti-vaxxers and some other people have tried to adapt this slogan. So first of all, I don't believe in slogans to begin with, but then trying to adapt it to accepting vaccines or not. However, the intent behind the slogan of bodily autonomy, I do believe in, and I think that the threshold, having a mandatory vaccine, is incredibly high. And you might reach that threshold, but I don't think it's been reached here. But that doesn't get away from the point that I'm saying, which is that when somebody makes a choice that they have a right to make, that right to make that choice does not come packaged with the right to have the rest of society insulate them from the consequences of that choice.
They don't want to be insulated.
The consequence of that choice. The consequence of that choice is that other people will not permit them to associate with them. And it is a reasonable thing to do to say people who make the choice not to get a vaccine will not be allowed to do certain behaviours that would put other members of society at risk.
And would you bring that? I mean, I'm sure a personal choice, if you want to socialise with someone, if you want to be friends with someone, absolutely, that's the right of freedom. But do you honestly believe, here we are in February of 2022, that if someone does not put a drug in their body, they shouldn't be allowed enter a restaurant, enter a bar? They have to sit outside. Their kids have to have their lunch outside in school. That troubles me.
I see exactly where you're going, but I think the driving license is the correct analogy here. That you can accommodate people. You can say, you can take the bus, you can have somebody else drive you, whatever, but you don't have a right to cause harm or risk harm to other people.
Have we ever excluded people from society like this in in the modern world, certainly in the modern Western world, maybe the last 50, 60 years, have we ever done this?
Yeah, absolutely. I mean, in Ireland, less so, but if you're in the United States, certainly if you're in Australia, if you were not able to drive a car for whatever reason, that would be enormously excluding from society.
Yeah, I mean, but I suppose taking a driving lesson and doing something, putting a chemical in your body, are quite different things to me. One is an action, the other is actually is a drug.
So first of all, the people who have objected to that typically have had very poor understanding of what they're objecting to. That doesn't mean that their objection is invalid. But the bottom line is, you don't have a right to make a choice that puts other people at risk.
Well, I've had COVID. I'm vaccinated. I'm due my booster, but I'm quite hesitant because my vaccine made me very ill the first time. But I'm told if I don't get it in the next 3 weeks, I won't be able to cross international borders within the EU. That bothers me. Because what next? Because if it's this now, do we use the same principles about something else in the future that won't suit people? And that's I guess that troubles me more than anything. That my issue isn't right now. It's if this is a justification for banning people from society or coercing them to do something they don't want to do, what next? If it's about keeping them safe, I mean, I probably drink too much for my own good. Should I be not allowed drink because I'm a burden on the health system? Should fat people not be allowed into it? And I know they're not endangering others, but they are if they're taking a hospital bed from someone.
I think that's a far more distant harm that you're causing to someone. Nevertheless, we have talked for a long time. Ewan Mackenna, newly introduced to me, thank you very much for talking to us.
I really enjoyed it.
If you like the Here's How podcast, please rate and review the show on iTunes and other podcast providers. Share it on Facebook and Twitter, but most of all, tell your friends.
Go to the website for references and sources from the show, and while you're there, you can like the show on Facebook, follow the show on Twitter at Here's How Podcast, and follow Ewan Mackenna at Ewan Mackenna, and get in touch with me if you can suggest a guest or a topic for a future show. Thanks again to all of the patrons on Patreon. Their donations allow us to devote time and research to finding interesting guests and topics to cover. And if you could do the same as them and donate €1 or $2 per podcast or per month, please do go to patreon.com/Here's How. That link is on the website. Also there you can find out how to subscribe to the podcast for free on your computer, on your phone, or by email. All that information is at www.here'show.ie. The Here's How podcast is produced and presented by me, William Campbell. The assistant producer is Kevin Wolf. Thank you for listening.